So when we talk to people about doing procedures here, a lot of education goes into it. I think the more you know about what we do here, the better experience you have. And part of that is also talking about the type of anesthesia that we do here. Most people are sort of familiar with, what anesthesiology is all about, whether it's other procedures they've had. But a lot of people ask about general anesthesia. And, what general anesthesia kind of refers to is sort of the deepest type of anesthesia where, patients are completely sedated, completely out, oftentimes requiring like a breathing tube, and the kind of things you see on TV. But here we do something that's just a little bit less than that. And I think that really intrigues patients because what we provide is something called total intravenous anesthesia. And so all the anesthesia you get is actually from an IV that we place the morning of surgery. And the medicines that we use get you completely asleep. You have no idea what's going on, but you're just not deep enough that would require a breathing tube. And so you're breathing on your own. You're completely comfortable. And what that allows us to do is really keep you at a very nice state of sleep. It's done by our anesthetist that is at your side the entire, portion of your procedure, where it's keeping you safe and monitoring things constantly. But it has some advantages, both to the surgeon and the patient. For the patient, I think people bounce back faster. Once the medicines are stopped from the IV, patients wake up very quickly. They typically wake up very clear-headed, which we love to see because I like to be able to talk to my patients before they leave and make sure they're comfortable and that there's nothing going on that I need to know about. And that's important to me. The type of medicines we use oftentimes lead to less what we call vasodilation, which all that means to you is that there's less sort of expansion of blood vessels. And so that leads to less bruising. And that's nice for patients to kind of get through a procedure, have minimal bruising, and are able to bounce back kind of socially from an appearance standpoint a little quicker. Intraoperatively for the surgeon, with less dilation of blood vessels, that means less bleeding. So the procedures that we do have less bleeding, and you can ask any surgeon, they'll always prefer, a better visual sort of surgical field when they're operating. And so I think that just leads to a lot of good things and all around kind of a better experience with the anesthesia, with less nausea and some of the typical things that people experience after what they're more familiar with, like a general anesthesia. And I think when patients hear that, it keeps them very comfortable about what we do here. They like the idea of that type of anesthesia, and they like the idea of the fact that the person that's providing it is at your side the entire time. And I think once they learn more about that, it seems just the right way to do things, and that's why we do it here.